Well, I just like to welcome everybody and thank you for coming on a Friday afternoon, at least where I am. I'm in Atlanta. Joining me for a couple of minutes rather, to answer some questions and learn a little bit about nutrition and mental health. My name is Vicki Steine, and I am a speaker for PESI, and I have a 3-day coming up in Seattle that I'm hoping that after you hear this talk today, that maybe you will come and join me there. So you can see on your screen where you can sign up for that talk, and you can also use the code at the top of the screen. So I'm looking for some questions, hoping that we can talk briefly today about how do we use nutrition and mental health. I am a private practice therapist. I work with kids ages 8 and up. I've been doing this in private practice for about 13 years now. And I have a doctorate of science in holistic nutrition, as well as a licensed clinical social worker. And I've learned to integrate nutrition and other lifestyle choices that people make in terms of practicing therapy. So while I do things like cognitive behavior therapy, I also look at what people are eating. I look at whether they're exercising and what kind of sleep they're getting, and integrate that along with lab work and coordinating with other local doctors to treat the whole client. So when we work with clients, it's not just about what we can look up in the DSM. So if you look at the DSM-5, you'll see a cluster of symptoms. And so when we look at, let's say, for example, depression, there's not always a clear-cut reason for why people are depressed. You can have 5 different people in your office, and they all have 5 different reasons for being depressed. So one person may have something that's situational, but somebody else may have a nutritional deficiency. Somebody else may have some sort of an allergy or a food sensitivity that may also be creating those mental health issues. So when we look at functional medicine and we look at integrative work, we're looking at how do we combine the traditional psychotherapy along with doing these other interventions, like looking at whether somebody is eating properly or eating at all, for that matter. And then how do we apply that to our work? So I'm here to take any questions and to talk a little bit more. So I see one of the questions that's come in is that clients typically don't come to therapy expecting that it might benefit them to change what they eat. So how do I help clients to open up to learning the relationship between food and mood? And this is a great question, and I learned this the hard way because I had some clients who would come in when I first started doing this kind of integrative work, and I would get really excited, I actually still do, about trying to implement food. And I've had clients who would come in and say, well, I came here to talk to you about my depression. Why are we talking about what I eat? So I have to do a lot of education. It's really important at the front end. Well, first of all, I have a degree in nutrition, so a lot of times people aren't terribly surprised. So if you don't have a degree in nutrition, you're going to have to do a little bit more education. So learning how to educate the client on how the brain works and to coach them and educate them on the fact that our brains and our bodies are connected. And so what we do to our bodies is going to also impact our brain health and vice versa. And I'll do some education around the vagus nerve and how the gut is attached to the brain. And that if we're going to have, let's say, for example, if somebody has a gluten sensitivity or celiacs, or has IBS or IBD, irritable bowel syndrome or irritable bowel disease, that inflammation can also impact the brain. And if somebody has diabetes, we know that there are a lot of comorbidities with depression and anxiety with these kinds of either gut issues and or diabetes. So educating our clients, helping them to make the connection. And a lot of times when I start educating them, they'll sit back and they'll say, oh, yeah, that does make some sense. And then I will also use a lot of my own experiences, which I've had quite a bit of experience with my own mental health and with my own diet and diet choices. So sometimes you have to do it, you have to move slowly. Sometimes people are more open to it, but educating them that this is an important piece of how we are now treating people. And if you want to do a little reading on the side between now and maybe when you come to the training in May in Seattle, there is a new field that's called nutrition psychiatry. And the nutrition psychiatry field is all about how do we integrate nutrition into our practices. So let's see, I see a bunch of other questions coming in. And so I want to make sure, let's see, I'm interested in how I apply both nutrition and mental health. Won't clients in private practice, can you give some specific? Okay, well, I think I just answered that. I'm an LCSW and I work at an advanced heart failure office. I'm always talking to our patients about a low sodium and heart healthy diet. Also need to take care of body and mind. Absolutely. And in this training, we'll talk a lot about a lot of different diets. Like there are options for our clients to have. There are lots of elimination type diets like the paleo diet, the ketogenic diet. All of these can have huge impacts on brain health. But there are also diets like just helping people who are eating what we call the standard American diet, which is the acronym is SAD, which is that high sugar, ultra processed, lots of carbohydrate diet. So teaching them to eat maybe just from a Mediterranean diet, just trying to add in more whole foods, trying to get them off of the junk food. Let's see, can I share what program I completed my PhD from? Sure. So I went to a school called Hawthorne University, which was based out of California. Unfortunately, during the pandemic, they did go out of business. They have since transferred a lot of whoever was in school at the time to, I think it's the American Health and Science School or Academy. I'm not exactly sure what the name of that school is. But I went to Hawthorne University. It was a fabulous program. Dr. Liz Lipsky, who wrote a book, several versions of the book, Digestive Wellness, and still lectures on the holistic, out there on the holistic area, was my mentor and my committee chairperson. I also completed a year-long program with another school called the Integrative Functional and Nutrition Academy. And that's run by Dr. Sheila Dean and Dr. Kathy Swift. And Sheila and I were actually at Hawthorne together. And then she and Kathy spun off and did this year-long program, which when I did it, it was fresh and I did it live, but now it's a recorded program online. And I do highly recommend that. It's really a master's, an additional type master's degree. So I think those are, let's see, I think those are the questions. Are there any other questions that I can answer? Oh, here we go. What are some of your frequently used nutritional interventions and how do I track progress? One of my go-tos is going to be gluten-free, dairy-free diets. But the very first thing that I want to do is I really want to evaluate what's going on. So I'm going to do an intake. And I'm going to look at what's going on with that client. Because again, when it comes to things like depression or anxiety, there are multiple causes for why people are experiencing these mental health issues. So for example, this week I had a client, she's 13 years old, really breaking my heart because she got COVID a couple of months ago. And since then, her OCD has just exploded. And she has sensory issues that have also become extremely significant. So, for example, she has terrible sensitivity to light. So when her mom brought her into the office, she was wearing an eye mask, and her mom was literally leading her by the hand like she would someone who didn't have any sight. And she sat in my office she couldn't even sit still. She's moving. She's explaining that her body doesn't feel right. So I'm going to treat somebody like that very different than, say, my 60 some odd year old person who says, I have anxiety, I have OCD, um, but they've led a very high functioning life. But now that they're retired, things seem to be a little bit worse. And so the first piece is really to evaluate the person and to figure out what exactly is going on. And then from that point, I'm going to want to look at what their diet is. I'm going to usually have them fill out a nutrition log, a 3-day log, and evaluate what they're eating. There are two things that I like to know from that information. One, I want to know what they're currently eating, because I want to know what they like. Because I want to know if I'm going to help them switch up their diet. If they like crunchy, salty foods, then I'm not going to be trying to introduce something that's sweet or something that's mushy. I'm not going to ask them to eat okra if they like crunchy stuff. So I like to know what their tastes are like. I like to know if they have any sensitivities. A lot of people don't like things like tomatoes, things that they consider slimy. So I want to know what they're eating so that we can introduce new foods that meet those same kinds of criteria. But I also want to look at patterns like, are they eating healthy fats? Are they eating fruits and vegetables? Where can we start adding foods in? It's easier, I find, to add things in than it is to take things out. So asking people to hang on to what they are currently comfortable with and just starting to add some foods in so we can push out some of the other foods is the way that I like to start. And then tracking is also with using food diaries, and or it's simply tracking their improvement. So ideally, if you can get somebody to fill out food diaries on a regular basis, then they can bring in information and say, okay, well, this week I added in apples, bananas, and celery. And then the next time they come in, I added in whatever the next goal was. And so we track it together. Frankly, a lot of clients don't like to track. So I do a lot of self-report. So tell me what you did yesterday. What kinds of improvements did you make this week? Occasionally, I will get somebody who does like to keep track and likes to show up with all of their paperwork. And those are the best to work with in terms of tracking information and helping them. The ones that are vaguer, it's a little bit harder because we don't always remember what we've eaten. And so people are popping stuff in their mouth as they walk by their coworker's desk. They pop a Hershey's Kiss and they don't even think about it. But if they write it down, then it helps us to track and say, oh yeah, I do this on a regular basis. This is a pattern I have. So ideally people track, they don't always do it. And obviously as they start feeling better, it becomes very obvious. I had a client years ago who came in, she was very depressed and she couldn't get out of bed and she was crying all the time. And the first intervention we did from the very beginning was we looked at what her food intake was. And we did this in the very first session. I asked her permission if she was okay with that. And she said yes. And so we did an intervention with just adding some protein to her diet. And she came back in a few weeks later and she was feeling significantly better. So that was pretty easy to track. So let's see if we have any other questions that are coming up. I think we might have one more. Let's see. How can nutritional interventions improve outcomes for clients with depression and anxiety? Well, that question could take all day. There are lots of different things depending, again, on evaluating what's going on with the client, evaluating what kind of depression they have, what kind of anxiety they have. It could be that they're having issues with serotonin. They could have issues with GABA. They could have adrenal issues. They could have some sort of a B complex deficiency. Maybe they're not methylating properly. And so their ability to create, to convert folate to methylfolate so that they can make serotonin is impaired. And so looking at what's going on with the client, evaluating it, and then adding the right supplements and or adding the right nutrition. And of course, always staying within our scope of practice, always understanding what we can and we can't do within our own licensing and within our own states. So we'll be covering all of that in Seattle. So I do hope that, again, if you would like to join me, that you can sign up. Again, you can see at the bottom the banner of how you can register, going to pesi.com / Stein23, or the code at the top left. So again, I want to thank all of you for taking a few minutes to come today and join me. And I hope that you will come and join us in Seattle. It's a beautiful city. I'm looking forward to being there, and I look forward to meeting all of you there.